So today's topic is nutritional supplements. It's a small topic. We may finish it within 1 hour. Okay. After that, we'll discuss about the exams for those who still have some queries regarding the exams. Okay. 15 to half an hour, we'll discuss about the exams. So those who have the textbook, please mention the page number in the chat box. Those who have the old textbook, the page number is 453. Nutritional supplements is 453. So we'll start the section. So nutritional supplements, it's a group of products which are taken along with diet to improve the health. And nowhere these supplements, they are not like compulsory. Okay, those who are healthy, those who do not have any deficiency, macro or micro. Okay, with your diet, with sufficient diet, with a balanced diet, if you are able to maintain a deficiency-free health, okay, you do not need supplements. It means your diet, your balanced diet is doing everything functional for you. There is nothing that you have to worry, or you may don't have to take any additional supplements, which means healthy people do not need to take any supplements. Okay, these nutritional supplements are not substitute to food. Remember that. If you're taking the nutritional supplements, it does not mean you do not have to take food. You have to take food. Nutritional supplements, by and large, they function to aid more nutrition wherever your food is lacking, just to fill that gap up. Okay, that is the main aim and main role of nutritional supplements. And also, in some cases, so if some clinical management for you is going on, or for any person, if a clinical management of a specific disease condition is going on, nutritional supplements will make sure that their body is able to adapt to the absorption. Because usually when you are sick, if you're going through any chronic condition, if you're going through a clinical treatment or management, most of the time what happens is that you are not able to absorb the nutrients from the food properly. We see this usually in old age people. As a process of aging kicks in after your midlife. Okay, the later part of the life, when aging is accelerated. Okay, aging happens at any at all, every time aging is happening to you. But after your midlife, okay, aging accelerates. Okay, when aging accelerates, your body is not able to keep up with nutritional absorption. That is when you may have to have the requirement to take some nutritional supplements. Otherwise, even if you are going through some critical illness, you have some digestive issues, okay, to aid the absorption, because nutritional supplements are made in such a way, they are partially hydrolyzed or partially digested, or they are made with such synthetic materials that it is easier for the intestine to absorb. The digestive tract does not have to do much work to break down the food to get the nutrients. The nutrients are available as it is in the it's in its the synthetic raw form. It is available for absorption. Okay, so that is the role of nutritional supplements. In the new textbook, the page number is 459. So a person has to have regular home cooked balanced meal to be healthy. Okay, and your diet should mainly focus more on whole grains, fruits, vegetables, legumes, nuts, seeds, etc. Okay, any phytochemicals, fiber, whatever your food home cooked meal is giving you, that should be a focus. That should be a first priority. Okay, only to top up your food when you know that if you have a vegan diet or a vegetarian diet, okay, there are certain cons to it. Okay, just to nullify those cons, you may require nutritional supplements. Okay, like when if you're following a vegan diet, calcium, vitamin D, vitamin B12, okay, these supplements you may require. Millions of people right now, after, like, there is a nutritional wave, a nutritional awareness wave that is hitting everyone. Majority of the people who live in urban cities and all, a nutritional awareness wave have hit most of the populations all over the world. Okay, so we tend to take some or the other form of vitamin or mineral supplements on a daily basis. Okay, just to keep you safe against any nutritional deficiencies that could lead to some chronic health problems. Okay, and many healthcare professionals also have accepted it, that if the food is not sufficient, if the bulk of the food is not something that you can have on a daily basis, okay, in that case nutritional supplements are there to aid your diet. Okay, so compared to the food sources, supplementation can be in different form, dosage, combination with other nutrients as well. Okay, so reasons why you take nutritional supplements. First is advertisements, the influence of advertisement. Okay, usually nowadays people, if you are following any YouTube influencers, or they are getting sponsored, they are getting paid partnership with certain nutraceuticals or certain companies that push nutritional or healthy living. So they may be advertising it, but that advertisement may also have a lot of influence on the consumers, whoever is consuming the digital content. Okay, so advertisements play a very key role on influencing you to take some specific supplements. Protein, it could be protein powders, whey protein powders, plant protein powders, omega-3 fatty acids, some nutritional supplements. Okay, some gummy, like nowadays gummies for hair growth, skin health. Gummies are being targeted specifically for the target audience is young women. Okay, every advertisement also always has a target audience. It could be mothers, okay, lactating mothers, pregnant mothers, for your child's health. Okay, and for young women it could be skin, hair, just for cosmetic purposes. Okay, for men it could be to build up the body, bulk up the body. So every advertisement has a target audience behind it, and which they are successfully catering to. Okay, so advertisements are influencing your potential of buying more and more nutritional supplements. So some people, they just directly get influenced and they think that okay, their diet is lacking vitamins and minerals. They have to rely on supplements. To an extent, it is true. Okay, the kind of food. If I pose a question to you, the kind of orange that you were getting 20 years back, is the quality of the orange same today? The nutrients that you would get from an orange, one single orange, if you take that used to get 20 years back, today you may have to take two or three oranges of the same size, flavor profile, to get the same benefits what that orange was giving you 20 years back. Okay, so that is true. Soil quantity quality has reduced, but soil quality will not affect the agriculture to that extent, because to enhance the soil quality we have other ways as well. Okay, definitely soil quality is reducing because of deforestation, lots and lots of soil erosion that takes place specifically in hilly areas. Okay, if you are procuring any vegetable or fruit from the hilly areas, the nutrient depletion is larger in hilly areas, mountainous areas, than as compared to the plain. Okay, the plateau or plain areas. Okay, and some people believe that minerals have an effective means of treating and preventing health problems and conditions. For example, if I compare your regular iodized salt and pink salt, okay, which do you think is better? Regular iodized salt or pink salt? All these salts are same. Okay, pink salt, rock salt, iodized salt. Okay, all these for double fortified salts, all these salts, 95% of them, they are just sodium chloride. 95% of them is just sodium chloride. 5% of it could vary. If it is an iodized salt, it may have iodine. If it is a double fortified salt, it will have iodine along with that iron. Okay. If it is an Himalayan pink salt, Okay, 99% of it or 97% of Himalayan pink salt is sodium chloride. Remaining 1 or 2% would be some trace minerals. But the amount of salt that you take on a daily basis, okay, these minerals are completely negligible to your body. There are minerals, yes, but you hardly take one entire teaspoon of salt throughout your entire day. Okay. And the trace minerals present in that 1 teaspoon of salt that you take through the entire day in breakfast, lunch, and dinner, it's completely negligible to your body. Okay. So it's not that, and you also have one more salt, that is low sodium salt. Low sodium salt is prescribed, okay, when a patient, a person is suffering from hypertension, high PP, or cardiovascular diseases. The cardiologist will prescribe them to use low sodium salt instead of the regular salt. Only that has health benefits for the specific target people, those who are suffering from a specific condition. Okay, so in that condition, they will have to take low sodium salt. But otherwise, all the regular salt, okay, it's better. Legally, the table salt that you use at home in India, it is legal, it is enforced by law that all the table salt should be iodized. Okay, pink salt and other rock salt and all, they are not fortified, they are not iodized. Okay, but if you tend to take pink salt or rock salt, make sure you have iodine rich food. Okay, you are taking iodine rich food. You can use any of these salt. Okay, you can use any of this salt, but if you are going for rock salt or pink salt, make sure the iodine uh, iodine from mineral deficiency should not affect you. Okay, it will not make any difference. Salt is not supposed to give you minerals. The salt is only supposed to meet your sodium and chloride requirement. No other minerals are, if the requirement can be fulfilled only if it is fortified. Okay, the other trace minerals, it will reach your body, but it is negligible. Okay, for example, let's say 500 or 200 microgram of selenium is what you require on a daily basis, RDA. But if you just rely on pink salt, you will be hardly receiving 2 microgram of selenium. The remaining 198 microgram, you have to still get it from your food. Okay, so that it does not make any sense. It does not make any sense. Okay, same Celtic salt or any tectonic plate salt, any salt. Okay, if it is a salt, okay, you are using it for its sodium chloride composition. Whatever additional you're getting, it is going to be negligible because humans have a very limited salt intake. Okay, believes that your food lacks nutrients, so it could be true as well. Okay, if your food generally consists of something very monotonous, okay, daily you're having the same food, there is no variety in the food. Okay, you tend to have less amount of fruits and vegetables. Maybe you live in certain areas, okay, like rural areas or in high range area, hilly areas, where accessibility to fresh fruits, vegetables, or seafood it's very difficult. Okay, so in such cases there is no other option, you may have to rely on nutritional supplements, and there is nothing wrong in that. Okay, and to treat and prevent health problems, to treat health problems in the sense, if for example, if it is iron deficiency anemia, first stage of iron deficiency anemia, using nutraceuticals you can still combat it. Okay, second and third stages of anemia, you will require a clinical prescription, a medical prescription. Nutraceuticals would still work, but it is better, the option is always better to go and see a physician, go and see a GP, a general physician, and get your prescription done. Okay, so you are treating anemia, at the same time you are preventing the chance of having anemia in the future as well with nutritional supplements. Okay, If hypertensive patients are advised to take Celtic salt, most probably the Celtic salt should be low in sodium. Okay. The only reason why hypertensive patient or cardiovascular patient would be advised to take a specific kind of salt, the reason is it is low in sodium. It's not because it has other minerals. Okay. The reason only is it could be a low sodium variety. Okay. That is only the medical inference of it. Specific disease conditions like TB and diabetes. Here you, for example, TB, what kind of macros would a TB patient require? Usually when you see a TB patient, we know they have lost their appetite. Okay. They can't keep up with their macros requirement. So what is a macronutrient that a TB patient will require through nutritional supplements? It is protein. Okay, it is protein. TB patients undergo a lot of muscle wasting. Okay, so their protein requirement is relatively quite high. But the food, through food, if you are trying to give them fulfill their protein requirement, it would be very difficult because these patients, they have a low appetite. They may suffer from nausea and vomiting. Their body is already weak. Their digestive system is already weak. They cannot keep up with digesting proteins. Which is easier to digest? Is it protein, so carbohydrate, or fat from the macronutrients? Carbohydrates is the easiest to digest. Protein is the most difficult part to digest. Okay, that is the reason why protein is a thermogenic food. Okay, your body has to undergo tremendous effort to digest protein. Okay, so that's the reason why TB patients, we usually recommend them protein supplements to combat their muscle wasting and to fulfill their protein requirement. In diabetes as well, complex carbohydrates, other micronutrient deficiencies can be combated with nutritional supplements. Improving the physical performance in sports nutrition, for example, caffeine, okay, taking just a shot of black coffee or an espresso coffee, okay, before you work out, that improves your physical performance more in gym. Okay, your focus level is high, your energy level is high. Specific kind of food, specific nutritional supplements, taking up a specific kind of protein before you go to gym, and after workout you indulge in a protein shake or something, okay, to make sure that the lean muscle mass that you have used up is built sooner. Okay, so that is a targeted use of nutritional supplements. To reduce weight as well, there is very less evidence that nutritional supplements may lead you to weight loss. Okay. Uh, for example, L-carnitine is something that is quite famous for its fat burning capacity, but we don't have much evidence regarding that. But also, to reduce weight, you have to reduce your calories. If your calorie intake is less than 1000, less than 1500, you will require nutritional supplements by default. Okay, if somebody has prescribed you to lose weight and a dietitian had made a diet plan for them in which the day-to-day calorie intake, daily calorie intake is around 1500 kilocalories or less than that, okay, based on their body specificity. Okay, so in that case, nutritional supplements is required because of the variety of meal or variety of food that fulfills your 1500 kilocalories requirement. They usually will not fulfill the micronutrient requirement. Okay. L-carnitine is produced in your body. It is not an essential nutrient. It is already produced in your body, L-carnitine. But some people may require more dose of L-carnitine to move their fat, okay, to make the fat movable so that it can be disposable. Difficult to get some nutrients through diet. Specifically, iron. Iron is a very tricky nutrient to be absorbed just by diet. So in that case, iron supplements during pregnancy and lactation is very helpful. Even though if you're having iron rich food during pregnancy, it is ideal to always follow up with an iron supplement so that you don't have a chance of going into a stage of deficiency for pregnant mothers. And during pregnancy, definitely physiological changes of pregnancy, a lot of changes are happening. Your body's demand is increased, it is double, specifically by third trimester. Okay. Some diet coke, I would not recommend diet coke for weight loss at all, because just like sugar, your artificial sweeteners are also addictive. Okay, artificial sweeteners can also be addictive. Diet coke is filled with an artificial sweetener. It may or may not give you calories, but it can still cause insulin spike, not as much as sugar, but it can still cause insulin spike, and it can lead to addiction. Okay, any form of artificial sugar can lead to addiction, except for stevia for a very less time. Okay, long studies we don't have about stevia yet. So far, stevia and monk fruit is supposed to be the best form of artificial sugar with low calories, but we don't have a long term research done on them. Okay, that is a drawback. So diet coke, which is rich in artificial sweeteners, I wouldn't recommend that to anyone for weight reduction. Okay, even though it may not be giving you calorie, but it is satisfying your taste buds. Okay, and over time you will crave for more and more artificial sweeteners than sugar. Okay, so that's not a good plan. Don't take calcium and iron tablets together. Omega-3 fatty acids, now different types of nutritional supplements. There are different varieties, okay, 1,000 types of nutritional supplements, but we will just discuss the most common one. Okay, like omega-3 fatty acid, it in development of your eye cell, brain cell during young age, and even after you have become an adult, a matured adult. Okay, cell differentiation for your skin cell differentiation, to prevent acne, to prevent adult acne. Okay, to have clear skin, to have a focused brain. Okay, and to make sure your eye health is good, omega-3 fatty acids is required. If you are a vegetarian, you can use flax seeds. Okay, flax seed oils are also available, just like fish liver oil, cod liver oil. Nowadays, flaxseed oil is also available. If you don't like the taste of it, you can just pop a flaxseed oil capsule. Okay, it will work the same way. And from out of omega-3 fatty acid, always make sure when you are buying omega-3 fatty acid nutritional supplements, check for the DHA. Okay, docosahexaenic acid. That is the full form of DHA. Okay, DHA is a type of omega-3 fatty acid. There are 3 different types of omega-3 fatty acids. You have to focus more on DHA. Okay, DHA is the type of omega-3 fatty acid which is responsible for your nervous system health, okay, brain health, brain cell health, and your eye health, vision health. Okay, and also decrease the risk of coronary heart disease, to prevent autoimmune diseases. High cholesterol levels can and hypertension can also be brought down. It will not treat. Okay, remember, nutritional supplements will not treat you, but it can aid in the performance of other clinical management. IBS people can also have, it is beneficial for inflammatory bowel syndrome, ulcerative colitis, Crohn's disease. These are digestive tract diseases. Suppress of for suppressing tumor growth, for suppressing breast cancer, occurrence of breast cancer, colon cancer, prostate cancer. For all this, omega-3 fatty acids are helpful. Okay, if you have a family history of all these cancers, it's better you indulge in omega-3 fatty acid food. Okay, if not, if eating fish is not a regular thing, or having flax seeds is not a regular thing, then you can definitely go for a supplement. Then folic acid, you cannot prescribe supplements, but you can prescribe nutraceuticals. Okay, in nutraceuticals, always go for FSSAI certified nutraceuticals. Okay, I have mentioned in the chat box. Folic acid and iron, specifically for pregnant women, they should take this folic acid and iron to prevent birth defects in their unborn child, and also to prevent anemia in themselves and also in their unborn child. Okay, a child when it's growing in the mother's womb, its iron stores completely depends on mother's iron intake. If mother is not achieving the adequate amount of iron intake, the child who is growing within the mother's womb will also be born with less iron stored in their liver. So the child is already at a high risk of getting anemia even before the child reaches 6 months of age. Okay. Adolescent girls, teenage girls, as soon as they start menstruating, as soon as a girl child hits puberty, menarche, iron tablets has to be given. In government schools, it is given free of cost. And even if you're planning for pregnancy, okay, for in the next 1 year, if you're planning to get pregnant, make sure you correct your anemia and folic acid deficiency before you get pregnant. Okay, because it prevents the risk of having a premature baby or abortions, spontaneous abortions, miscarriages, etc. Since the bioavailability of iron is very poor, that is the way how your intestine can absorb iron from sources of food, that is bioavailability, it is very poor. It's better you make sure you have some nutritional supplements that has adequate iron for you. Multivitamins and minerals, it's a combination of all vitamins and minerals. Okay, useful when the individuals are deficient and they are found deficient. How can you find that you have a specific deficiency? Anyone in the chat box, how can you find out that you are deficient in a nutrient? Blood test. You have to do the blood work. There is no other way. Okay. Hair fall can happen even because of stress. Your skin can damage even because of stress. Okay. But blood test will give you the exact root cause of why it is happening. So you can correct that. So always remember, don't depend on the signs and symptoms. Signs and symptoms can overlap for various other disease conditions. Okay, there could be 10 different disease conditions which share the same signs and symptoms. Okay, you can't self-diagnose it. You have to do a blood test. Okay. And also in elders, senior citizens who already have poor digestion and absorption, nutritional supplements will be required to them. B complex vitamins, specifically for people who have polished rice. Specific areas in India, geographically, for example, Orissa, West Bengal, Bihar, okay, parts of Karnataka, Tamil Nadu, Brahmin community, okay, they all have their staple food is polished white rice, okay. And when they only have polished white rice, there are high chances of vitamin B complex deficiency. So they have to take vitamin B complex vitamins, okay. Having more processed food. Those who are having whole grains or pulses like ragi, millets, parboiled rice, brown rice, okay, if that is a part of your staple diet, you may not require B complex vitamins, okay. But those who have polished rice or polished cereals for that factor, if that is the staple food, make sure you are taking vitamin B complex as well. Calcium and vitamin D. Calcium and vitamin D. Calcium supplements, usually they come fortified with vitamin D. Okay. And also, if you are buying, have you noticed this when you buy a milk packet? Have you read it on the milk packet what all vitamins it is fortified with? Because now it is by law you have to do this. If you're getting milk directly from the dairy farm, you don't have the option of getting the fortified milk. But if you're using a packaged milk, it could be any packaged milk, tetra packaged milk, or your regular blue, green, orange, different packaged milk. Have you seen the first part of your packaging itself? Vitamin A and vitamin D, it is compulsory. Okay, this is by state. All the state government has to enforce it. For example, if it is Tamil Nadu, they have almond milk. In Karnataka, Nandini. In Kerala, it is Milma. Okay, New Delhi, the north side, it is Mother Dairy. Then you have Amul. Okay, so yeah, all these different brands of packaged milk, by law, by the state government laws, they have to fortify it with vitamin A and D. Okay, and sometimes if you're getting plant-based milk, soy milk, almond milk, oats milk, okay, usually it will come fortified with calcium as well. Calcium, vitamin A, vitamin B12, and vitamin D. Okay, these four vitamins and minerals should be there in the should be there as a part of fortification in any plant-based milk if you're buying. Okay, it is easy to make it at home as well, but you miss the chance of using the fortified milk. Okay, if you are buying the tetra packaged one, that is better because it nutritionally that is much better, because calcium, vitamin A, vitamin D, and vitamin 12, okay, which are naturally less in number when it comes to plant-based milk. Okay, bioavailability is very less, so it's better to use the fortified versions. And also, if you have kids at home or if you have a sweet tooth, you can follow this technique as well. Um, are you aware of the condensed milk that you get? Condensed milk that you use for desserts and all? The 150 ml one. Okay, so just buy a vitamin D sachet. Okay, the weekly ones, the weekly sachet that has granules, vitamin D granules, which you are supposed to mix it in milk and then have. Usually doctors prescribe you this. If you get that sachet, just put one sachet of vitamin D into that condensed milk, mix it properly. Okay, and every day just have 1 spoon of it. Okay, your vitamin D requirement will be fulfilled, and it is a very tasty alternative. Okay, instead of using vitamin D sachet on a weekly basis, just once on a weekly basis, okay, it's better to put this granules, vitamin D granules from the sachet directly into the condensed milk packet that you get, mix it properly and keep it aside. Okay, every day just take 1 teaspoon of it and have it. Okay, it is high in sugar, so that's the best way how you can give it to kids. In pediatric nutrition, we teach it. Okay, kids can have 1 spoon of condensed milk, will not aggravate your sugar spike or anything. Okay, instead of having a lace packet, or if you're having a biscuit packet, okay, instead of having that just after your food, just after having a meal, if you feel like having something sweet, make sure you have this. It is giving you good nutrition of vitamin D as well, with the added benefit of vitamin D. Sachets are prescribed. Okay, usually the doctors will say that once a week you have to use one sachet. If Saturday you're using one, every Saturday you have to use the vitamin D sachet for the next 2-3 months. So sometimes you may forget weekly. If you want to take a medicine, you may forget. Okay, so this is the better alternative. It should be refrigerated. If you have opened the condensed milk, it should be refrigerated. Even if the milk is coming from directly from any dairy farm, it's always better to use a pasteurized milk. Okay, always make sure you use a pasteurized milk. Antioxidants are another form of nutritional supplements, usually vitamin C and vitamin E. Okay, vitamin C and vitamin E is the most common one. For cosmetic purpose, people go for glutathione. That is also a good antioxidant. Okay, Glutathione is also a good antioxidant. That is also a nutritional supplement you can take. Vitamin C supplements are available. Vitamin E supplements are available. Beta carotene and retinol, lutein. It should not be recommended for long term. Protein concentrates like whey protein, etc. Athletes who want to improve their physical performance, okay, they take nutritional supplements based on protein like whey protein, casein, egg protein, soy protein. These are the most common favorite of athletes. Consuming milkshake or milk based some anything after, just after you have done your gym training, weight training, okay, to make sure that you don't lose your lean mass, you develop more lean mass. If you're lactose intolerant, whey protein will not be suitable for you. Okay, so you may have to use some plant-based protein. Protein energy supplements are also available for young children who suffer from protein energy malnutrition. Can anyone say what is the name of it? Students who are appearing for this year's exam, what is the name of that protein energy supplements? Yes, F75, and F100, that is in clinical management. Okay, that is the part of clinical management. Ruft is the one that is used at home. Okay, ready to use therapeutic food. Ruft. Okay, you just have to open the package of this Ruft and give it to the child. Nothing else has to be done. Okay, it was created by the Nutritional National Institute of Nutrition, Hyderabad, NIN. Okay, they came up with the Ruft chart. Ruft means ready to use therapeutic food. Ready to use therapeutic food. That is the full form of Ruft. Read the chapter of protein energy malnutrition, severe acute malnutrition. You will know what is Ruft. The last part of the chapter. Okay. So Ruft is prepared with peanut powder, roasted peanut powder, milk powder, sugar. Okay. In a specific ratio, it is prepared, and it does not require refrigeration or anything like that. Easy to use. Then zinc supplements, glutamine supplements. Glutamine supplements is given for during chemotherapy as well. Those who are on pain medication, okay, they receive to decrease the pain medication and decrease the mouth pain and all. Glutamine is given. Zinc supplements will boost your immunity, will prevent acne as well. Delayed wound healing, etc. That could be cured with zinc supplements. Vitamin C. Vitamin C supplement, topical application is also available. Oral supplements are also available. It's a really good antioxidant rich vitamin, vitamin C, but it is water soluble. So on a daily basis, you will have to take what a vitamin C supplement or vitamin C rich food. It aids in immunity, it helps in wound healing, just like zinc. Then you have fiber supplements like whole grains, fruits, vegetables. Okay, these all have good quality of fiber. Only if your diet does not contain on a daily basis, if you're not consuming green leafy vegetables, raw fruits and vegetables, okay, or you have a lifestyle or you live in such places where um, access to fresh fruits, vegetables, green leaf vegetables is difficult. In that case, you can use fiber supplements like isabgol is there, okay, that you can use. It is a soluble fiber. too much of supplementation of fiber is not advised because it could lead to some other gastric issues. And it's always better to use fiber in natural form than in supplementation form. So, highlights from the chapter: your first line of defense is the nutrition from food. Okay, your priority should be getting as much as nutrition, macros, and micros from the food. And based on your lifestyle or your choice of diet plan, okay, some diet plans like vegetarian diet or vegan diet naturally lack in specific kind of nutrients, okay, like iron or vitamin D, vitamin B12. Okay, these are naturally low as compared to non-vegetarian diet. It's low in vegetarian diet or vegan diet. So you have to take a corrective decision to indulge in supplements. Okay. So your nutritional supplements are not supposed to substitute your food. It is only supposed to aid your food in a better holistic way. Supplements are life saving in certain clinical conditions because certain medication can suppress the rate of absorption of your intestine. Okay. So when the body is working under a suppressed situation, nutritional supplements are better because it is also giving nutrition to the body, healing the body. At the same time, medical management is also going through. So it's a life saving situation that supplements can come in. Toxicity: too much indulgence in supplements could also lead to toxicity. Toxicity will not happen overnight. Okay, it happens on a day-to-day basis. It takes months and months for toxicity to show its symptoms. Okay, so please be aware of it if you're indulging in supplements, which means if your food is already rich in a specific kind of nutrient, make sure you are not using supplements of that kind. Those who are vegans, make sure vitamin B12, vitamin D, calcium, and omega-3 fatty acid supplements are being taken to prevent osteoporosis, to prevent any mental health diseases. Okay.